Hello guys, welcome to another session. My name is Mbamara Ebube. I'm from Nigeria and I'm a student of Harikov National Medical University. I'm on my fifth course, 6 faculty, grade 13. And as you can see on my slide, I'll be talking about Marfan Syndrome. So just in case any question pops up and you're wondering, what is Marfan Syndrome? I hope this video help you to understand the basics of Marfan syndrome. So let's continue and ask, what is Marfan syndrome? What is Marfan syndrome? In case someone walks up to you, maybe a non-medical student or a non-medical practitioner asks you, what is Marfan syndrome? Oh, my child was diagnosed with it. What is it? So I want you to understand that it's an autosomal dominant genetic disorder that affects microfibrils and elastin in the connective tissue. These are basic components of connective tissue. But hold up. Let's rewind and rephrase the word autosomal dominant genetic disorder. So this means it's equally shared in both male and female. I want you to understand that the pattern, it can be both in male, it can be in a male or a female, equally around the world. Do you understand that? So, and it can be inherited from only one parent who have the defective gene, which is fibrillin 1 or FBN1. Let's continue. Just listen and let's move on smoothly. Marfan syndrome is an autosomal dominant genetic disorder, like I said, that affects microfibrils and elastin in the connective tissue. So these fibers help in anchoring your organs or other structures together. You see, it's flowing out. It's equally shared in both male and female. It can be passed down from one parent who have the defective gene. It affects the microfibrils and elastin. These are fibers that help anchor your organs and structures in your body. You see, smoothly. So let's move on. So I want you to know the symptoms of this Marfan syndrome can be in a patient mildly, moderately, or severely. Hope you got that. Let's continue. So I want you to also know that in 10,000 people or 20,000 people, there must be a person who has the defective gene fibrillin, which results to the word or the syndrome called Marfan syndrome. Listen, so in every 1 in 10,000 people or 20,000 people, there must be a person who has a defective gene. I think in the UK, they made a study of 5,000 people. There's always a person who has a defective gene of fibrillin 1 or FBN1. So you're understanding now. So just in case you don't know, it's hereditary, meaning it can be passed to a child from a parent who is affected. So let me drink some water here. So it means it can be passed to a child from a parent who is affected. And in most cases, 75% of cases, Marfan syndrome is inherited from one parent. Again, 75% of cases, it is inherited from one parent. Also, like I said, the syndrome is autosomal dominant, which means a child can inherit it even if only one parent has the defective gene or the syndrome. So therefore, in a parent who has the deficit gene, there's a 50% chance or a 1 in 2 chance that the child will inherit the syndrome. So if a parent has the Marfan syndrome, 50% chances the child will have the syndrome. So you're wondering, 75%, where did the other 25% go? Like how is it, inherited? First, it can be idiopathic, meaning nobody knows, how, you know, it's happening. But the other 25%, even if the parent doesn't have Marfan syndrome or have been diagnosed yet, there will be mutation first time in the parent's egg or sperm. That is either the mom or dad. Like I said, is equally shared. Like anyone can have it. So it can mutate in the egg or sperm. That can be something else. Then this mutation then pass on to the child who will then go develop the syndrome. There's a photo here, I just want you to get a picture and understand it. If here's the defective gene and normal gene, then, they cross in this new generation. You can see the child with Marfan syndrome, without Marfan syndrome, without Marfan syndrome, then a child with Marfan syndrome come across it. So the etiology, like I said, is when there's a mutation in the gene, which is fibrillin. So just in case you don't know, fibrillin is a glycoprotein that forms a supportive sheet around elastin. You understand that? So the gene defect leads to abnormal production of protein called fibrillin, resulting in parts of the body be able to stretch abnormally. So now, common sense, if a person is lacking or mutation has happened in elastin and the microfibrils, the fibrillin that helps hold and anchor the body together, what happens? Then the person would be, nothing can hold the bones together, for example, so it goes longer. Common sense. So the defective fibrillin gene also causes bones to go longer than they should. They should grow taller than they should. Their arms and legs grow longer than normal. Don't worry, we will talk about the, clinical futures. I want you to know that it's a glycoprotein that forms a supportive sheet around elastin. What is elastin? Elastin is a connective tissue protein that is responsible for properties of extensibility and elastic recall in tissues. They help anchor the organs together. So they are in lungs, they are in blood vessels, they are in amount of ear and skin, and there are ligaments, they are in small amounts, they are mostly in every tissue. Fibrillin. What is fibrillin? It's a large glycoprotein that is structural component of microfibrils of 10 to 12 nanometers fibers found in many tissues. It is secreted into the extracellular matrix by fibroblasts and becomes incorporated into the insoluble microfibrils, which appear to provide a scaffold for deposition of elastin. I hope you got that. So let's, come here and talk about the clinical futures of Marfan syndrome. So, like I said, if there is a defect of the gene that helps anchor the body together, what happens? Then there will be something called arachnodactyly, meaning an abnormal long limbs, slender limbs, fingers, and toes. Making sense, right? So you can also see, lens fracture, that is dislocation, moving away from where it's supposed to be, anchoring. And get the word anchoring. They'll be flexible, elastic recourse, helps for extensibility, elastin. So there's a defect in that, a disorder in that. So there'll be so flexible joints, there'll be retinal detachment, there'll be stoop shoulders, there'll be hammer toes, there'll be flat feet, there'll be vertebral column deformity. And you see, I jumped mitral valve prolapse because it's like a component, it's like a complication, and I'll talk about that. I wasn't even meant to put it here, so I'll talk about mitral valve prolapse. It's a very serious complication, like I put here. You know. Also, we can even see, they grow taller, they shoot, they have, myopia, corded teeth, mitral regurgitation, narrow, highly active palate, dilation of the aortic root, you know. So there are lots of clinical features of Marfan syndrome. Complications of this Marfan syndrome. What can happen? We can see dental and bone problems. That is, patients with Marfan syndrome may have a dental history of tooth extractions, narrow palate. Patients we have even histories of bone problem, such as, like I said, flat feet, hammer toes, hernias, and bone dislocations. There's nothing holding it together. There's a deformity there. There's a defect there. And we can also see changes in the eye, like I said. You know, there was a study that came out and they were saying more than half of all people with Marfan syndrome have eye problem, including nearsightedness, that is blurring of the object far away, lens subluxation, other words, lens fracture, that is, it moves away from its typical position, or having a different shape of the eye, other problems. And you can see, 90% of people will have blood problem, like blood vessel changes. You can even see cardiomyopathy, and as well the mitral, valve prolapse comes in. And I'll talk about them. Just listen. So, like I said, 90% of people with Marfan syndrome get blood problems, blood changes. You know, like I said, without anything anchoring the tissues, the organs, the structure of the body, there'll be dilation there'll be flexibility, even also in the blood vessels. The blood vessels will become weak and dilate. That is, it can be wide open. So this blood vessel can have a lot of effects in the whole human system. For example, can affect the aorta, the major artery that carries the blood from the heart to the rest of the body. So when the walls of the heart is weakened or stressed, there will be increased risk of aortic aneurysm, aortic dissection, or busting, aortic plaster, busting. I don't know how to explain it anymore. So if all, for example, all portions of the aorta are dilated or dissect, it can result to serious life-threatening problems. Let's move on. We can also see, heart valve problems, when especially the mitral valve, you know, it becomes floppy and do not close tightly, then guess what? Blood will be flowing backwards across the valve, which is called mitral valve prolapse. So can you see how Marfan syndrome has a lot of effects in the human body? And note, these effects can be moderate, mild, or severe. So the heart valves, especially the mitral valve, can be affected by Marfan syndrome. I want you to know that. That is when it becomes floppy and does not close tightly and allowing blood to flow, regurgitation, backwards. So it's a really serious condition. And there's also, heart murmur, which can be heard through a stethoscope. You can see cardiomyopathy. You know, even if the valves are not leaking, it can lead. It can lead to heart failure. That is when the muscle of the heart has been enlarged, hypertrophy, or weakened over time. And we can also see, aortic root dilation. That is where the aorta meets the aortic valve with Marfan syndrome. It may dilate or widen. This causes aortic valve to become stretched and be leaking, leading to arrhythmia, abnormal heart rate. You can major complications can lead, you know, major complications. Even in the lungs, also we can see, changes in the lung tissue, increase the risk of asthma, emphysema, COPD, bronchitis, pneumonia, even collapsed lung. You can see skin changes, decreased elasticity of the skin, stretch marks occur even without changes in the weight. So have major complications, And I'll show you a photo, which I really loved. I got it from osmosis. Marfan, the word Marfan. So you can see mitral valve prolapse when it becomes weakly and allow blood flows backward. Aortic dissection, retinal detachment, when the retina moves away from the real position is meant to be. Fibrillin 1 mutation, arachnodactyly, one, there are slender limbs, long abnormal bones, scoliosis, I'm going to show you photos of, Marfan syndrome patients. For example, you can see this. This can be caused by the defects of fibrillin, scoliosis. You can see flexibility, you can see abnormal long arms and, slender limbs. Probably patient is having hammer toe or hammer feet, flat feet. You can see changes even in the thoracic bone. I mean, anything can happen. Anything, even with the physical appearance. Like I said, their arms, legs, fingers, their toes may seem out of proportion, their spine may be curved, and their breastbone, like in this case, their joints may be weak, easily become dislocated. Sometimes they have long, narrow face, and the roof of their mouth may be high, a lot of teeth, causing a lot of teeth to be crowded. So it's a really, serious case. So let's move on with the diagnosis. Let's move on with the diagnosis. So, like I said, we can just see, diagnose a patient by few changes. A patient can be born with Marfan syndrome, and later in the adolescent life, changes start occurring. So we can diagnose it even visual. We can do genetic testing, even blood tests. Let's take it slowly. So a blood test can be used to help diagnose Marfan syndrome. That is checking for, LBN1 gene that is responsible for most cases of Marfan syndrome. And it's not every time you check for LBN1 gene that is always, always, sure to diagnose Marfan syndrome, because we can check LBN1 gene and see mutation, and there are other mutations like Loeys-Dietz syndrome that cause similar physical findings like Marfan syndrome. Sorry, English is not my first language, okay? So we need to, go on with the test, for example, genetic testing. Genetic testing is so wild, We just have to, do the laboratory tests, looks for changes, that's the mutations in the person's genetic material, which is the DNA, things, but But about this genetics testing, it's so really expensive. Approximately $2,000. To test for genetic testing. So there can be easier tests that can be done. You know, but we'll go towards it. Let's talk about genetic testing. Also, you can see, other tests like electrocardiogram. You can use chest X-rays. If the sections of the outer are not be able to visualize through echo, we can, use transophageal echo, MRI, even computated topography scan can be needed. With CT. CT is really, really not expensive unlike genetic testing. We can also use CT or MRI to determine dural ectasia. That is the bulging of the lining of the spinal column. So different tests can be helped to diagnose Marfan syndrome. You know, so how to treat it is where how to treat it. We have to treat it using lifestyle changes. This is a very important treatment, conservative treatment, lifestyle trading. So sorry, I just paused the recording session, by mistake. So let's move on. How is Marfan syndrome treated? We can do the lifestyle issues, follow up, routine follow up, including cardiovascular eyes, skeletal exams, especially growing in the eyes, activity, guidelines to prevent, the disease and symptoms. Most people with Marfan syndrome can participate in some physical and recreational activities. Those with dilation of the outside will be asked to avoid high intensity. So these are just avoiding the symptoms to, progress more and more, And also we can also, during pregnancy, genetic counseling should be performed prior to pregnancy as Marfan syndrome is an inherited condition. So you really need a counselor to help you. That's our treatment because you don't want the child, suffering. So those with high level of risk cases, the outer, So these are just follow-ups, what to do to avoid it, avoid it. And also we can do endocarditis prevention. That is people who have valve surgery have increased risks of bacterial endocarditis. In case you don't know, this is an infection of the heart or valves which occurs when the bacteria enters the bloodstream. So to reduce the risk of endocarditis, antibiotics should be given prior to dental or surgical procedures in patients with Marfan syndrome. Check with your doctor to the amount of antibiotics, if specific. You can even have a wallet card maybe obtained from the American Heart Association with specific antibiotic guidelines. Yeah. So those are the type of follow-ups to do. Then we can also give medications. Sorry, let me get some water. Some medications are used to treat, Marfan syndrome or to prevent serious or control the complications. For example, a beta blocker improves the heart's ability to relax, decreases the forcefulness of the heartbeat and pressure. In people who are not able to take beta blocker, for example, in asthma patients, we give calcium channel blocker such as verapamil is recommended. Angiotensin receptor blocker helps. The blood pressure clinical trials have been conducted for this medication with aortic enlargement. So it's really a great type or class of drug to be taken with the patient with Marfan syndrome. Also surgery, surgery in the case of rupture aorta, aortic dissection, treating valve problems. So you go through these slides to see, the aorta diameter is more than 4.7 centimeter to 5, depending on your height. So if an aorta is enlarged at a rapid pace, surgery should be given. Surgery should be recommended. You go to your cardiologist and go for some surgery. So the recommended for surgery is based on the size of the aorta. The rate, the growth, the age of the child. There are different factors. So also valve repair. Surgery may be needed when Marfan syndrome causes a big leakage of aortic or in the mitral valve. Then blood flows back. Surgery is needed. You know, so there are different types to just follow up the complications. And help the patient's life better. That's the most important of them all. So I think I just went through it. So yeah, my references to go through where I got this information. I got it from Osmosis. I got it from, Cleveland, UK University. I got it from, Harvard. So these are the link, you know, these are the link. Just, try and go through it. I got it from Edema, a very reliable source, that I program that helps students, ease the stress, So I'd love for you to go through Edema. And there's some Marfan syndrome, few basics in case you want to learn. Yeah, so that's basically all. Thank you so much for your attention. And sorry, I don't have a thank you, thank you slide, but thank you for listening attentively, and have a wonderful day, and have a blessed day. Thank you so much.